Do doctors need coding to work with AI? Welcome to the channel dedicated to the latest technologies in healthcare, pharmacology, and medicine, as well as the exciting future developments in these fields. The medical field is rapidly adapting to new technologies, and artificial intelligence is already beginning to change the way we diagnose, treat, and research diseases. However, one common question is, do doctors need to know coding to work effectively with these technologies? Let's break down the reality of this situation. Why understanding technology is important, but coding isn't necessarily required. AI systems in medicine provide doctors with powerful tools to assist in decision-making, such as diagnosing diseases, predicting outcomes, or even helping with drug development. However, the most crucial aspect of working with these systems is the ability for doctors to understand how they work and how to benefit from them. Doctors need to understand what data is important, how to interpret it, and what conclusions can be drawn. Understanding technology allows doctors to work effectively with IT specialists and use AI systems to their advantage. While programming knowledge can be helpful in specific cases, most doctors would benefit more from having a general understanding of how AI solves problems, how to use it in everyday practice, and how to avoid misinterpreting data. What do doctors need to know about AI in medicine? Doctors working with AI should understand the following key aspects: types of AI and their applications. For example, machine learning algorithms that analyze medical images, predict diseases, or find patterns in large data sets. Working with data. Doctors should understand how data is collected, structured, and used to train AI models. It's also essential to know how to ensure data quality. Ethical and legal considerations. AI in medicine raises concerns about data privacy, as well as potential errors in diagnoses and decisions based on algorithms. Why programming is not a necessity for doctors. Programming is an important skill, but it is not a necessary tool for doctors in their daily practice. Most IT specialists and engineers are responsible for developing software and training algorithms, while doctors use these tools for diagnosing and treating patients. Doctors with their deep knowledge in the medical field can collaborate with IT specialists and analyze AI-generated results without having to write code themselves. Doctors and IT specialists can work together to adapt technology to the needs of medicine. For instance, a doctor may use an AI system to analyze images or predict the risk of a disease, but it is the programmers and developers who work on making these systems accurate and efficient. The role of specialists and teams. Instead of every doctor learning how to code, it is much more important to develop effective teamwork between medical professionals and IT experts. In this context, a doctor who understands how AI works and how to use data can become a key player in the creation and implementation of IT solutions in medical practice. However, the primary role in developing and configuring AI systems lies with data specialists, programmers, and bioinformaticians who write code, create algorithms, and analyze large volumes of medical information. Collaboration between doctors and IT specialists allows the development of effective solutions that help make more accurate decisions in treatment, diagnostics, and research. Doctors with their experience and knowledge of clinical practice can help shape models that consider the clinical aspects that are vital for medical practice and adapt technologies to real-world conditions. IT specialists, on the other hand, provide the necessary tools and algorithms to process data, uncover patterns, and make the treatment process more personalized and efficient. This approach fosters the creation of innovative solutions that streamline workflows and assist doctors in making more informed decisions. For example, a doctor may use AI to analyze medical images or predict disease risks based on patient data, but for this to happen, they need to work with experts who can tailor algorithms to specific tasks and ensure their accuracy and reliability. Moreover, IT specialists can help train doctors and help them adapt to new technologies. For instance, they can explain how to use AI for diagnosing diseases or developing new treatments, while doctors can contribute necessary adjustments based on their expertise and knowledge of the field. Such teamwork is essential for ensuring that AI solutions can truly improve the quality of healthcare. Doctors will have the ability to implement these solutions in practice, while IT specialists create accurate and user-friendly tools that are ready for clinical use. This will also reduce the risks associated with algorithm errors, as medical professionals can make timely adjustments, thereby improving the overall safety and efficiency of the healthcare process. Biostatistics, an additional branch of medicine. For those interested in not only the clinical application of AI, but also data analysis, there is the field of biostatistics. This is the science that uses statistical methods to study biological phenomena and public health. Biostatistics often requires programming knowledge, as working with large datasets requires creating models for analysis and interpretation. A doctor who learns biostatistics can apply this knowledge to analyze medical data, identify patterns, investigate new treatments, and develop predictive models. While biostatistics requires programming and statistical methods, it can be particularly important for doctors working in research or in the field of drug development. Conclusion: doctors who work with AI do not need to know programming, but understanding how these technologies work and how to apply them in medicine will significantly improve their effectiveness. Instead of requiring each doctor to learn coding, it is much more beneficial to foster collaboration with IT specialists, which will allow doctors to use AI to its full potential and integrate innovations into real practice.